New question, the member from Hallam and Norfolk.
Speaker, to the Minister of Health, a year ago this legislature enacted a private member's bill to create a provincial framework and an action plan concerning vector-borne and zoonotic diseases like Lyme. The law mandates the framework and the action plan within a year of when it was passed. Obviously, the year is now up. Will the minister please outline to this House and to people affected by diseases like Lyme the required plan to take action?
Well, thank you, Mr. Speaker. And we have a Lyme reference group which is comprised of stakeholders on this issue that is working towards issuing a strategy together with the provincial government. We're working on a broader strategy as well. But I appreciate getting a health question because I feel compelled to address an issue that was raised by one of the member's colleagues earlier this week about the cancer care clinic in North Bay, Mr. Speaker. And I'm compelled to because this involves individuals and families who are suffering from cancer who have been shaken because of a rumor that was started by the member from Nipissing. And the rumor began with him and was promulgated by him. And there was no truth to it, Mr. Speaker. And the president of North Bay Hospital, as well as the head of the cancer clinic, had to come forward and publicly deny that there was absolutely...
Come to order, please. Come to order. People are taking a risk. There are votes today. Please finish. You have wrap-up.
Mr. Speaker, this is so important to the public interest. The member from Nipissing didn't bother to call the hospital, didn't bother to call the cancer clinic, didn't bother to talk to me. He promulgated a rumor which he knew was untrue.
Thank you.
And it's the crisis...
I know my job. Member will withdraw.
I withdraw.
Thank you. Supplementary.
Minister, I do ask you to come back to this issue, the deadline for action. On Lyme, received an email from a mother of a Lyme victim, and I quote, "People of Ontario need to know that our health care is like living in a third world country," end quote. Minister, people continue to go to the States for Lyme disease testing for treatment. We want to know, what is Ontario now doing as legislated to help these people? What's been done with respect to testing? What's been done with respect to treatment, to prevention, surveillance? What new approaches, we've had a year, do we now see with respect to education and research? The tick season, the mosquito season, is now upon us. And Minister, I sincerely ask you, what has been put in place? Thank you.
Thank you. Be seated, please. Be seated, please. Thank you. Minister.
Well, thank you, Mr. Speaker. And the issue of Lyme disease and the broader strategy as well for dealing with similar zoonotic diseases that are prevalent in this province. It's an issue that's extremely important to me as a public health doctor. It's extremely important to the ministry. We're working hard. We have a reference group that is comprised of many stakeholders. Mr. Speaker, I want to commend as well the member from Algoma, Manitoulin. I'll be meeting with him next week, I believe, and a number of stakeholders specifically on the issue of Lyme disease, and I want to commend him for his proactive work and advocacy on this issue. It's extremely important. We have a reference group which is doing their hard work, which is working towards updating our strategy, our provincial strategy. And Mr. Speaker, I won't be satisfied until we have a strategy that reflects the best clinical guidelines and best evidence and science available so we can provide individuals that are at risk of or suffering from Lyme disease, whether that's acute or chronic, so they get the best possible care in this province that they could get.
Thank you.